How do you decide on single versus multiple embryo transfer? When it comes to assisted reproductive technology, choosing between transferring one embryo or several is a decision that involves careful thought. It's not just about increasing the chance of pregnancy but also about safety and health for both mother and baby. The main goal is to find the right balance between maximizing live birth rates and minimizing the risks of multiple pregnancies, which can lead to complications during pregnancy and birth. For women under 35, their eggs tend to be of higher quality, and their chances of successful implantation with just one embryo are quite good. In these cases, doctors often recommend elective single embryo transfer, or ESAT, because it keeps the chance of having twins or triplets very low. This approach helps avoid the health risks associated with multiple pregnancies, such as preterm birth or low birth weight, while still maintaining high chances of pregnancy. Women over 35 usually experience a decline in egg and embryo quality, which can lower the chances of success with just one embryo. In these situations, transferring to embryos might be considered to improve the likelihood of pregnancy. But even then, if high-quality embryos are available, especially with the help of pre-implantation genetic testing, doctors might still suggest single embryo transfer to reduce the risk of multiples. The decision often depends on individual circumstances, including ovarian reserve and previous fertility history. Embryo quality is also a key factor. If only one top-quality embryo is available, transferring just that one is often enough to achieve similar success rates as transferring multiple embryos, but with a much lower chance of multiples. When multiple high-quality embryos are available, some clinics might consider transferring more than one, especially in cases of older women or previous unsuccessful attempts. However, this increases the chance of twins or higher multiples, which carry higher health risks. The risk of multiple pregnancies is a major concern. Twins and higher multiples are linked to complications like preterm labor, gestational diabetes, and increased need for neonatal intensive care. Because of this, many health authorities recommend single embryo transfer whenever possible, especially for women with a good prognosis. This approach supports healthier pregnancies and better outcomes for both mother and baby. Guidelines from organizations like the American Society for Reproductive Medicine suggest that women under 38 with good quality embryos should consider elective single embryo transfer. For women over 38 or with poorer prognosis, the number of embryos transferred should be personalized, weighing the chance of success against the risks of multiples. Pre-implantation genetic testing can also influence this decision. By screening embryos for chromosomal normality, doctors can identify the best candidates for single embryo transfer, even in older women. This technology improves the chances of successful implantation and reduces the need to transfer multiple embryos. Patient preferences and individual circumstances matter too. Some women may prefer to transfer more than one embryo to increase their chances in fewer cycles, but they should be aware of the higher risk of multiples. Interestingly, studies show that the cumulative success rate over multiple single embryo transfer cycles can be comparable or even better than one cycle with multiple embryos and with fewer health risks. In cases where women have endometriosis, the decision can be more complex. Endometriosis may affect ovarian reserve and embryo quality, sometimes leading to a preference for transferring more than one embryo. Still, the risks associated with multiple pregnancies remain as important considerations. Ultimately, personalized advice from a fertility specialist is essential to determine the best approach based on individual health, age, and fertility history. In summary, choosing between single and multiple embryo transfer depends on age, embryo quality, health risks, and clinical guidelines. Younger women with good prognosis often benefit from elective single embryo transfer to promote safe pregnancies. Older women or those with specific fertility challenges may need to transfer more embryos, but always with careful consideration of the potential risks. Consulting with a fertility specialist ensures that each person's unique situation is taken into account, helping to make the safest and most effective choice for achieving a healthy pregnancy.